They were heard in 1948 when Harry Truman tried. They were heard in 1965 when Lyndon Johnson pushed through an overwhelmingly Democratic Congress in those days, Medicare and Medicaid. They were heard in 1993 yet again when Bill Clinton, and that was my first year in Congress, when we failed to deliver in health care. And today is no different. Just last week, leaders of the Republican Party met to decide, and you'd think I was making this up if you hadn't read it in the paper, they met to decide amidst two wars, amidst economic and environmental crisis, that they would try to adopt a resolution branding their counterparts as the Democrat Socialist Party. Who said the Republicans were out of ideas? Anyway, in this case, the Democratic Socialists of Europe are probably doing better than the plain old Democrats and Republicans are doing in the United States. We spend $2+ trillion on health care, more than any other industrial nation, yet the World Health Care Organization, as you may have heard, the World Health Care Organization ranks us 37th in the world among nations for quality of care. The U.S. ranks last in the world among developed nations in preventing mortality and other basic health indicators. Now, finally, most of America recognizes that health care reform is not just a moral imperative, it's become an economic imperative. There's no way to fix our economy without fixing our health care system, and there's no way to fix our health care system without cutting costs and without covering everyone. Americans account for more than 35 million hospital visits a year, more than 900 million doctor office visits a year, more than 64 million surgical procedures a year, more than 3.5 billion prescriptions are written a year. The health care costs are about 1/6 of our economy and, as you know, are growing. And the stories behind these numbers of businesses falling behind international competition, of small businesses struggling to attract new workers, of the failures of small business sometimes because of health care costs, of the broken hearts and the broken lives because of our failure to address these costs, they're all too real. These numbers combined represent the undeniable economic challenge caused by our broken health care system. We need to develop a system that reduces costs, preserves choice of coverage, and ensures access to quality care, as I said earlier. Reforming our health care system can reduce costs and provide quality care through a variety of ways. Increased use of information technology can cut red tape, can promote accuracy, can prevent costly, deadly medical errors. More on that in a second. We can reduce healthcare costs by investing in public health teams like those in Mansfield, those in the AIDS task force. There's so many people that are doing such great things in this community that monitor patients with chronic disease and promote healthy behaviors in their own communities. Reformed healthcare will invest in best practices to reduce medical errors, will save not only thousands of patients, but of course billions of dollars. Next month, the Ohio Patient Safety Institute will launch a statewide initiative to install safety checklists in hospital ICUs. Doesn't sound particularly complicated, doesn't sound particularly significant. Dayton Children's Hospital has already won national recognition for its central line procedures. It's not rocket science. The idea was adapted from, of all places, the airline industry. About 7 decades ago, very skilled pilots, as you know, very skilled pilots were starting to crash more complicated airplanes. And it was just simply too much for the human mind to process that a pilot had to do 14 things in a row in the right order, and the specific task had to do those things or the plane would malfunction. And so the pilots realized they needed a physical checklist so that they would do things in order to be able to fly the plane safely. And some wags have averred that if flying had the same error rate as hospitals and physicians, nobody would fly anymore. And that's probably, sadly, but probably true. But the reason for that is the same kind of thing that we don't do in hospitals. And that's something that people are beginning to figure out and to do, that hospitals provide, as a hospital at Johns Hopkins did with a Dr. Poonavants, who sort of first thought of this medical checklist. It's been tried in Michigan hospitals in the greater Detroit area, saved hundreds of millions of dollars, saved a couple hundred lives. More and more, I know hospitals in Cleveland are beginning to implement many of these kinds of ICU or central line catheter insertion checklists to begin to make the kind of progress we need to make. In other words, keeping what's working, fixing what's broken is the common sense approach to reducing costs. These investments can yield the greatest result only once we reform the health insurance market. Health insurance reform should include consumer choice that keeps private insurers honest. My conservative colleagues like to argue that the federal government could not run a two-car funeral. You could also argue that for 8 years they tried to prove it. With such a dim view of government, though, you'd think they wouldn't worry much about giving people the option of sticking with their current private plan or joining a competing federal private plan. You'd be wrong. Today, private insurance competition is an oxymoron in a lot of places in Ohio. In Ohio, the two largest insurance companies account for 58% of the market. In some Ohio cities, it's up to 89%. Some insurers don't compete against one another. They use the same basic strategies to earn significant profits. These tactics include selectively insuring low-risk enrollees and slow-walking, sometimes denying as many claims as possible. Giving Americans the choice in health insurance will keep private insurers honest and make health care more affordable. But make no mistake, it does not mean doing away with the private market, as many detractors argue. It does not mean doing away with the private market. Reforming the health insurance market gives consumers a choice. If you like what you have, as I've said throughout this speech, you keep it. If you don't, you can look at a series of private plans or a public plan option. As I said, if you don't currently have insurance or want to change, then you can look from that menu of plans. One of these options, as I've suggested, is a federally backed insurance plan, which President Obama and I support. Last week, I introduced a resolution and was joined by 28 of my Senate co-sponsors, Senate colleagues as co-sponsors, calling for an inclusion of a federally backed health insurance option that will decrease cost and increase quality of affordable care. Federally backed insurance would provide direct, fair competition to the health insurance market. It might offer more services. It might limit out-of-pocket costs like high deductibles and large copays, but it would be set up in a way that the competition is fair and even between the public and the private plans. Depending on how the plan's designed, it could save American consumers between $750 million and $2.2 billion over 11 years. I'm sorry, and $1 billion over 11 years, I apologize. Historically, public health insurance has outperformed private insurance in preserving access to stable and reliable health care and reining in costs and pioneering new payment and quality improvement methods. Let me close with sort of a challenge coming from some information that people have gathered over the years. A few years ago, not that long ago, there was a survey taken of the richest of the large industrial wealthy democracies around the world: France, Germany, Canada, Japan, U.S., Israel, countries that generally provide good, solid public services, that have good high-tech medical care and generally good health care most of the time. And they surveyed these several different indices, surveyed these 13 countries, life expectancy, infant mortality, maternal mortality, inoculation rate, a whole host of different indices. The United States of the 13 nations ranked 12th overall, 12th out of 13. But in one category, the United States ranked near the top. And that category is life expectancy at 65. So in our country, if you get to be 65 years old, your chances of living a longer, healthier life are greater than in most, not every country, but than in the great majority of countries in the world. We've learned the hard way that consumers, so that's the argument for, I'm not arguing for Medicare for all. I know that a lot of people in this room like that, but I'm arguing that that's why we need that public plan option to give people that choice. We've learned the hard way that consumers can't always depend on private HMOs. Federally backed insurance that is affordable and available in all markets will give Americans an option when private insurance, at their decision, their request, at their choice, when private insurance fails them. It should be part of health reform that reduces costs, that protects choice of insurance plans, and that improve quality. Americans know that challenges to our healthcare system, our economy, and our nation are too big for opponents of healthcare reform to just say no. Saying no to healthcare reform this year, saying no is a policy decision. It means stay the course of a broken system, and staying the course of a broken system is simply no longer an option in this great, wealthy country. I hope collectively we'll have the courage and tenacity and skill of previous City Club speakers I mentioned at the onset of my remarks. Almost exactly 77 years ago, Franklin Roosevelt addressed the class of 1932